Assalamu alaikum. This is Mariam Kamil from Zahra University Health and Medical Technologies College in Radiology Department. Today we have a presentation about the X-ray of the tibia. The tibia is the larger and medial bone of the leg and the second strongest bone in the body. And it consists in the proximal, the medial and lateral condyle with intercondylar amines. And then we have the tibia tuberosity. In the distal end, we have the medial malleolus. In the shaft, there are the anterior border, the medial border, and the interosseous border. Also, we have the surface of the tibia, the medial surface and lateral surface, and finally the posterior surface. Photographing of the tibia. The tibia is photographed by two positions, AB position and lateral position. Then we have the indication that why we photographing the tibia, such as trauma, suspected foreign body, inability weight bear, and osteomyelitis. So what's the technical factors? IR size 43 x 35 cm or 14 x 17 inch and exposure 50 to 60 kVp with MAS 3 to 5 and SID 100 cm. The collimation at the proximal to the knee joint and at the distal to the ankle joint. The patient position for the AB view. First, the patient may be in supine or sitting upright with their legs striking on the table. Then the foot is in dorsiflexion, so the toes will be pointing directly toward the ceiling. Then we have the center eye. The center eye directed to the midpoint of the shaft of the tibia. So in the image we can see the proximal to the knee joint and the distal to the ankle joint with medial and lateral malleolus. The patient position of the lateral view. Firstly, the patient in the lateral recumbence, so the lateral aspect of the knee joint and the ankle joint will be in contact with the table. The leg is straight and place the opposite leg behind the injured leg to avoid over-rotation. Then we have the center ray that will be between the ankle joint and knee joint. Then we have the common tibia fractures. Diaphysis fractures is occur in the midshaft of the tibia due to the direct impact or a twisting or failing injury, as we see in the figure. The metaphysis fractures. This injury can happen when force is applied to the side of the knee, so we can say it occurs in the proximal third of the shaft of the tibia, while the leg is extended. Stress fracture is the final stage of stress injury, and that type of a fracture exactly occurs when the bone failure to withstand accumulated and repeated force. The question that the patient often asked when he had an X-ray examination, are they a risk to me? Is that thing is harmful? If you ask especially about TB examination, simply I will answer by no, it's not. Okay, but why are you so confident? Because the effective radiation dose is less than 0.0001 millisievert. So that means the amount used in tibia X-ray is small, actually it's very small, and the natural background radiation is less than 3 hours. The tibia X-ray examination may take about 15 minutes, but the actual exposure to radiation is less than a second, and that means it's safe and not considered dangerous. Finally, it's important to know that the technologist radiographer uses the minimum amount of radiation required to get the best results. And thank you for listening.